Hey, Impact Shapers! Ever sit in a meeting and hear those 6 creativity killing words? We've always done it this way. No! Oh. What if I told you that the most radical act in public health isn't rebellion, it's creativity? Today, we are breaking free from the status quo, and we're gonna get a little playful about how innovation can actually double our impact. Let me share something really familiar with you. As public health professionals, we are masters of meetings. Honestly though, our superpower is surviving back-to-back Zoom meetings while answering emails about scheduling more meetings about more meetings. But here's the thing, building partnerships is crucial to our work, but often we feel stuck because typically we don't have funding for fancy engagement strategies. I hit this wall recently when planning a really important partner meeting. I could already feel the weight of adding another meeting to everyone's calendars, let alone it was supposed to be in person. That's when I decided to get creative. Instead of another standard meeting, I actually themed it around croissants. I called it Croissants in Collaboration. And something unexpected happened. While we didn't have a huge turnout that day, the people who couldn't make it kept bringing it up for weeks. They were so disappointed that they missed our creative approach. Who knew that pastries could be so revolutionary? But here's what struck me. It wasn't the croissants. It was about breaking a pattern, introducing an element of joy and surprise into a boring, typical routine. In the conversations we had that morning, some of the most productive we've ever had. Now, let's break down how we can cultivate this type of creative thinking in our daily work. I call it the innovation mindset Trinity. First, permission to experiment. You don't need anyone's permission to try new approaches within your existing role. Think about it. Does your job description say must conduct boring meetings? I don't think so. Second, learning from plot twists. Because let's be honest, in public health, failure is just feedback. Every program that didn't work exactly as planned is data for your next innovation. Third, building on bright spots. Look for what's already working and ask, how could we make this even better? Now let me share 3 creative tools you can use tomorrow. Reverse brainstorming. Let's say you're trying to improve a health education program. Instead of asking, how do we make this program better? Ask, what can make this the worst health education program ever? Maybe you'd say schedule it at inconvenient times or use really complex medical jargon. And suddenly, you have a very clear list of what to avoid and how to do the opposite. Constraint flipping. Take your biggest limitation and ask, how could this constraint actually help us? No budget for printed materials? Maybe that just pushes us to create digital resources that reach more people. Cross-Pollination. Borrow ideas from completely different fields. What could public health learn from restaurants or gaming or theater? Let's try this one together. Go grab a piece of paper. Yes, right now, I'll wait. Think of one challenge you're facing in your work. Now let's apply the creative rebellion formula. Step 1, write down the we've always done it this way approach. Step 2, list 3 completely different fields or industries. And step 3, for each field, ask, how would they solve similar challenges? When I did this exercise thinking about community surveys, I looked at how food delivery apps gather feedback, how Netflix recommends TV shows, and how teachers assess students. Every fresh perspective provided a new idea for us to try. You are not alone in this rebellion. Every day, I see public health professionals who are shaking up the status quo. Whether it's turning dry data into compelling stories that move people to action, or bringing some energy to your team meetings with some creative facilitation techniques. These small acts of creativity ripple out to make bigger changes. This week, I challenge you to try at least one creative rebellion. Whether it's theming your next meeting, or flipping a constraint, or borrowing an idea from a different field, you can do it. Share your experiments using #PHCreativity. I can't wait to see what you come up with. Remember, Impact Shapers, innovation isn't about breaking rules. It's about breaking patterns. And honestly, sometimes all it takes is one croissant to start a revolution. I'm Veronica, and you're listening to Public Health Curated, where system change meets soul care. Keep sparking joy in public health. I'll see you next time.